What is the normal range for adult heart rate? Your options are 50 to 70 beats per minute, 60 to 100 beats per minute, 80 to 120 beats per minute, or 100 to 140 beats per minute. The correct answer is B, that is 60 to 100 beats per minute. The normal range for an adult heart rate is typically between 60 to 100 beats per minute. This range can vary slightly depending on factors such as fitness level and overall health. Question number 2. Which of the following is not a vital sign? Your options are blood pressure, temperature, weight, or respiratory rate. The correct answer is C, that is weight. While the weight is an important measurement in healthcare, but the weight is not considered as vital sign. The vital signs typically include temperature, blood pressure, pulse rate, and respiratory rate. Question number 3. What is the primary function of white blood cells? Your options are transport oxygen, fight infection, clot blood, or carry nutrients. The correct answer is B, that is fight infection. White blood cells, also known as leukocytes, play a key role in the body's immune system by fighting off infection and foreign invaders such as bacteria and viruses. Question number 4. Which of the following is a symptom of hypoglycemia? Your options are high blood sugar, excessive thirst, sweating and trembling, or slow heart rate. The correct answer is C, that is sweating and trembling. Hypoglycemia or low blood sugar can cause symptoms such as sweating, trembling, and confusion, and even rapid heartbeat. It is important to promptly treat hypoglycemia to prevent complication in the future. Question number 5. Dear friends, welcome back to Dear Competitive Exam YouTube channel. Today, you are attending 100 most repeated and most important question answer session based on nursing interviews. And this is the part 1 of this series. So get ready to challenge yourself. And friends, if this video is helping you, then make sure to hit that subscribe button below. Your support means world to us. So don't miss out. Hit subscribe now and let's keep the journey going together. Question number 5. What does the acronym CPR stand for? The options are cardiopulmonary resuscitation, cardiovascular rehabilitation, continuous passive range of motion, or comprehensive physical review. And the correct answer is A, that is cardiopulmonary resuscitation. CPR stands for cardiopulmonary resuscitation, which is an emergency procedure performed to manually preserve brain function until further measures can be taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. Question number 6. Which of the following is an example of sterile procedure? The options are taking a blood pressure reading, inserting a urinary catheter, administering oral medication, or assisting with bathing. The correct answer is B, that is inserting a urinary catheter. Inserting a urinary catheter requires a sterile technique to prevent infection. Sterile procedures involve maintaining a sterile field and using sterile equipment to minimize the risk of contamination. Question number 7. What is the correct technique for hand hygiene? Your options are washing hands with water only, using hand sanitizer without rubbing, washing hands with soap and water for at least 20 seconds, or wiping hands on a towel without drying them completely. The correct answer is C, that is washing hands with soap and water for at least 20 seconds. The proper hand hygiene involves washing hands with soap and water for at least 20 seconds, making sure to cover all surfaces of the hands and fingers, including under the nails, to effectively remove dirt, germs, and pathogens. Question number 8. Which of the following is a sign of respiratory distress? Your options are bradycardia, cyanosis, hypertension, or bradypnea. The correct answer is B, that is cyanosis. Cyanosis, a bluish discoloration of the skin or mucous membranes, indicate oxygenation and is indicative of respiratory distress. The other sign may include rapid breathing, increased heart rate, and anxiety. Question number 9. What is the purpose of a Foley catheter? Your options are to monitor cardiac output, to administer intravenous medication, to drain urine from the bladder, or to measure intracranial pressure. And the correct answer is C, that is to drain urine from the bladder. The Foley catheter is a flexible tube inserted into the bladder to drain urine. It is commonly used in patients who are unable to urinate on their own due to surgery, injury, or certain medical conditions. Question number 10. Which of the following is a priority nursing intervention for a patient experiencing anaphylaxis? Your options are administering antipyretics, applying cold compresses, administering epinephrine, or encouraging deep breathing exercise. And the correct answer is C, that is administering epinephrine. Anaphylaxis is a severe allergic reaction that requires immediate medical intervention. Administering epinephrine is a priority to reverse the symptoms of anaphylaxis, including airway constrictions, low blood pressure, and hives, and to prevent life-threatening complication. Question number 11. What is the purpose of the Glasgow Coma Scale, GCS? Your options are to assess pain levels, to measure cognitive function, to evaluate neurological status, or to determine fluid balance. The correct answer is C, that is to evaluate neurological status. The Glasgow Coma Scale, GCS, is used to assess the level of consciousness in patients with head injuries or other neurological conditions. It evaluates eye opening, verbal response, and motor response to assessing a score that indicates the severity of brain injury. Question number 12. What is the primary purpose of the Bishop score in obstetrics? Your options are assessing fetal heart rate, evaluating the readiness of cervix for labor induction, monitoring amniotic fluid levels, or measuring maternal blood pressure. The correct answer is B, that is evaluating the readiness of the cervix for labor induction. The Bishop score is used to assess the cervix's readiness for labor induction by considering factors such as cervical dilation, effacement, and fetal station. Question number 13. Which stage of labor is characterized by the delivery of the placenta? Your options are first stage, second stage, third stage, or fourth stage. The correct answer is C, that is third stage. The third stage of labor involves the delivery of the placenta after the birth of the baby. Question number 14. Which of the following is a priority nursing intervention for a patient with a fever? The options are administering an antihistamine, applying warm compress, providing adequate hydration, or administering a bronchodilator. The correct answer is C, that is providing adequate hydration. Adequate hydration is important for a patient with a fever to prevent dehydration and help the body to regulate temperature. Encouraging fluids can also help thin respiratory respiration and alleviate symptoms. Question number 15. Which organ is responsible for filtering blood and producing urine? The options are liver, kidneys, pancreas, or spleen. The correct answer is B, that is kidneys. The kidneys filter waste products from the blood to produce urine, maintaining the body's fluid and electrolyte balance. Question number 16. Which of the following is a priority nursing intervention for a patient with a fever? The options are administering an antihistamine, applying warm compress, providing adequate hydration, or administering a bronchodilator. And the correct answer is C, that is providing adequate hydration. Adequate hydration is important for a patient with a fever to prevent dehydration and help the body to regulate temperature. Encouraging fluids can also help thin respiratory respiration and alleviate symptoms. Question number 17. Which bone forms the forehead? The options are mandible, maxilla, frontal bone, or occipital bone. And the correct answer is C, that is frontal bone. The frontal bone forms the forehead and the upper part of the eye sockets, contributing to the structure of the skull. Question number 18. Which of the following is a function of the kidneys? The options are regulation of blood sugar levels, production of red blood cells, regulation of blood pressure, or secretion of digestive enzymes. The correct answer is C, that is regulation of blood pressure. The kidneys play a crucial role in regulating blood pressure by controlling fluid balance, electrolyte levels, and the renin-angiotensin-aldosterone system. Dysfunction of the kidneys can contribute to the hypertension. Question number 19. Which white blood cells are involved in antibody production and immune memory? Immune memory. The options are monocytes, eosinophils, lymphocytes, and basophils. The correct answer is C, that is lymphocytes. Lymphocytes, especially B cell and T cells, play a key role in adaptive immunity by producing antibodies and forming immune memory. Question number 20. Which of the following medication is commonly used to treat hypertension? The options are metformin, lisinopril, insulin, or aspirin. The correct answer is B, that is lisinopril. Lisinopril is an angiotensin converting enzyme inhibitor commonly used to treat hypertension by relaxing blood vessels and reducing blood pressure. It is often prescribed as a part of comprehensive treatment plan for hypertension. Question number 21. Which blood type is considered the universal recipient in terms of plasma donation? Your options are A positive, O negative, AB positive, or B negative. The correct answer is C, that is AB positive. AB positive individuals can receive plasma from any blood type, making them the universal recipient for plasma. Question number 22. What is the recommended method for calculating a patient's body mass index BMI? The options are weight in kilograms divided by height in centimeters, weight in pounds divided by height in inches squared multiplied by 703, height in meters squared divided by weight in kilograms, weight in kilograms divided by height in meter squared. Correct answer is D, that is weight in kilograms divided by height in meters squared. BMI, body's mass index, is calculated by dividing the weight in kilograms by the square of the height in meters. It is commonly used to measure to assess body composition and categorize individuals into underweight, normal weight, overweight, or obese categories. Question number 23. What is the primary purpose of the electronic fetal monitoring EFM during the labor? Your options are assessing maternal blood pressure, monitoring uterine contractions, measuring fetal weight, or administering pain relief. The correct answer is B, that is monitoring uterine contraction. EFM is used to monitor uterine contractions and the fetal heart rate during labor, providing valuable information about the well-being of the fetus. Question number 24. Which childbirth position is associated with the reducing perineal trauma? Your options are supine position, lithotomy position, squatting position, or Trendelenburg position. The correct answer is C, that is squatting position. The squatting position during childbirth is associated with a reduced risk of perineal trauma and may facilitate the birthing process. Question number 25. Which muscle is responsible for internally rotating the shoulder joint? Your options are infraspinatus, natus, teres minor, subscapularis, or supraspinatus. The correct answer is C, that is subscapularis. The subscapularis muscle is located on the anterior surface of the scapula and is responsible for internally rotating the shoulder joint. Repeat. Friends, it is a time to comment your score out of 25 questions. And friends, thanks for joining us and learned something new. Then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you. Take care.